Hi, I'm Chris Lee, and this is Virtually Speaking. Thanks for joining me. Today, our guest is Dr. Klasko, who's an advocate for transformation in our systems of healthcare and higher education, and is the current president and CEO of Thomas Jefferson University and Jefferson Health, overseeing over 35,000 employees. He has led Jefferson to become one of the fastest growing academic health centers, expanding from 3 to 14 hospitals and growing revenues from $2.2 billion to $9.2 billion in 2020. Dr. Klasko was named one of the most creative people in business by Fast Company for making large-scale healthcare personal. He also was ranked number 2 of the 100 most influential people in healthcare by Modern Healthcare in 2018. He was appointed as the first distinguished fellow at the Davos World Economic Forum, and in 2020 will co-chair the World Economic Forum Board of Stewards. He is a multiple best-selling author, and his latest title is Bless This Mess, A Picture Story of Healthcare in America. This year, in 2020, he will publish 2 much-anticipated books. Please join me with Dr. Klasko now. Well, hello, Stephen. Thank you for joining me here on Virtually Speaking. How are you doing today?
Doing great. I wish I was actually in this background. This is the house that I never get to anymore since I've been trying to deal with 35,000 employees and a few million patients with the COVID pandemic. But I can think about it at least.
Nice. So, but you're in Pennsylvania right now.
Yeah, right now I'm in my office in Thomas Jefferson University and Jefferson Health, which is a bit of the epicenter. If you think about it, Chris, we have 35,000 employees, so the second largest employer in Philadelphia. We have 14 hospitals, so the largest health system in the area, had by far the most COVID patients. And I have a 3-campus university, of which 1 campus is in Rome, Italy. So,
oh, wow.
So everything that could happen with the pandemic, I've had the pleasure and honor of dealing with.
Right. And so what's going on with your hospital in Rome, Italy? That must have been a really bad situation there for a minute.
Well, it was, although it's really interesting. We've been really prepared for this in the Philadelphia thing, partly because of our colleagues in Italy. My number 2 person is the former mayor of Rome. So he was actually in Italy when it hit the fan, and we were able to actually talk to the folks there, literally starting in January, before most people could spell COVID.
Right.
And it sounds funny, but they were willing to tell us everything they did wrong. So
oh, good.
It was
good.
a little bit of, okay, guys, this is what not to do.
Right.
And so we've had, it's hard to talk about success in COVID.
Right.
Well, we had about 60 days PPE on hand. We've had by far the lowest number of employees that have been affected with COVID.
Oh, that's great.
We were the first in the city to do all masking. We have a design university, so we created some masks that were actually reusable.
You have a design university as part of Jefferson University?
Yeah, it was one of the cool things that we did. Yeah, we merged a 195-year-old health science university with the number 3 fashion design university in the country, number 7 in the world.
Wow.
And what's cool about that is we created the first MD Masters in Design. So if you think about it, and this really fits into the whole post-COVID world.
Yeah.
The whole key is going to be the design of the human experience. Right now, the human experience of accessing healthcare is just lousy. For those of you who are my age, I always say we have Star Wars technology for individual patients in a Fred Flintstone healthcare delivery system.
Oof.
I'm a high-risk obstetrician. The way that I treat an individual patient has changed a lot in 35 years when I had hair. The way patients access the system has hardly changed at all. They're still getting on the phone, listening to 11 options to get an appointment next Wednesday.
Right.
So the real question for all of us is this pandemic sort of okay, gosh, we have to be consumer facing for a little bit and then we'll go back to our shell? Or is this really the Amazon moment? Is this really the iPhone moment?
Well,
and,
I heard it was basically fast forwarding 10 years and 10 weeks is really kind of what's going on here to get
it's hard to say if that lasts. It's really hard to say if that lasts.
Right.
Because we have a very fragmented system. Look, I think I'm a distinguished fellow of the World Economic Forum, so I lead the
Right.
board of stewards for the digital economy for Davos. And one of the CEOs of a large finance company said, Steve, 30 years ago, the two sectors that didn't get the consumer revolution were banking and healthcare. And then he
Uh-oh.
stopped and he said, now you're alone.
Now you're the only
So,
one.
yeah. So, because if you think about it, if you're my age, 30 years ago, if we had this pandemic, everybody would have been talking about what we have to do on Fridays when everybody goes to the bank to deposit their checks, right? Because that's
Right.
what you used to do. We would have had to have social distancing for the people going to get money and deposit their checks.
Right.
And and banking literally decided that they were going to move from 90% in the bank to 90% at home. It wasn't just like, we don't get up in the morning and say, I think we're going to telebank. So it wasn't just one thing. We get all caught up in telehealth. That's not the key. We need to go from
Okay.
sick care to health assurance starting at home. And that's what I hope will really be the disruption.
So what does that mean? Sick care to health assurance at home.
So what it means is we've run a system based on how literally hospitals telling patients how they should get treated.
Okay.
You're lucky to see me. The fact that you have to wait 2 weeks to see me and come in
At
for
least.
an appointment and wait for an hour with a lot of other sick people in the waiting room,
Right.
and then come in and I will do a static thing of your data and then give you my wisdom. We've allowed that to happen. Insurers have said, hey, I got even a better gig. I'm the middleman. And my whole gig is making sure that I can take as much money in and have to pay as little money out.
Right.
So if you think about health policy in the last 10 years, all we've argued about is how to pay for a fundamentally broken, fragmented, expensive, inequitable, and occasionally unsafe healthcare delivery system,
Mm-hmm.
and hope that delivery system will transform. So for me, and we have a book coming out in just a couple of weeks called Unhealthcare, a manifesto for health assurance, of, again, moving from a model of hospital-directed sick care to how can you make sure that you can thrive without health getting in the way. Chris, you don't view yourself as a patient, most likely. You view yourself as a person who would like to stay healthy.
Right.
And if you have a problem, you view yourself as a person that would like to be a patient for as little time as you can be.
Right.
We view everybody as a disease and a patient.
Right.
So the key is, so your car, Chris, gets better care than you do. What I mean by that is, depending on what kind of car you have, my car sends out signals while it's in the garage.
Mm-hmm.
And when I wake up in the morning and I go to start it, it says, not quite this, but Steve, while you were sleeping, I lost some air in my tire.
Right.
Could you please fill up the air?
Yeah.
We have this model where once a year or once every 2 years, you go to a doctor's office. Based on that day, at that time, we take your blood pressure, we take your pulse, we get the data, and we say, based on that one time,
Mm-hmm.
here's what you should do for the rest of the year.
Ridiculous.
Yeah. So the book is about, it's really cool because it's co-written with an individual named Hemant Taneja, who's the managing principal for General Catalyst, the initial investor in Airbnb, Warby Parker, the healthcare company Livongo. And if you think about Airbnb,
Mm-hmm.
it was saying, it used to be if you want to build bigger and better hotels than Marriott, you had to build bigger and better hotels.
Right.
Now you build no hotels and just bring people together.
Right.
Uber, Amazon, all those things. So what we said is, what is that in healthcare?
What's that version? Yeah.
Yeah, the version of healthcare is that healthcare starts at home. You have continuous data.
Continuous data. So that means you're wearing something that's monitoring you and it's keeping track of your sugar levels, your blood pressure, all that kind of stuff.
Yeah, so the most successful IPO, health IPO in history was a company called Livongo with Hemant, and,
Right.
and we were involved in also at Jefferson, which was pretty simple. It was, all right, so diabetics, let me get this straight. You're gonna pee in a cup, dip something in there. This is 2020. And then you're
Wow.
gonna literally, call your doctor, send the results. This was using AI around diabetics at home. So what this book starts out with, Chris, is so a Silicon Valley entrepreneur and a CEO of a 195-year-old academic medical center walk into a bar and ...
Right. Okay, great.
What if you embedded virtually 270 engineers into a 14 hospital system? And what if you embedded what's actually happening in healthcare out to Silicon Valley?
Right.
Because both are clueless about the other. So that's what's exciting. So yeah, our most
So did you
successful
guys
thing
do that? Are you guys embedding? Are
oh
you
yeah,
guys,
yeah. We have basically a joint venture where we have General Catalyst folks embedded at Jefferson, we have Jefferson folks embedded at General Catalyst. We've done a company together called Comure, which is it's basically an app store for healthcare. It's a FHIR layer, FHIR, which overcomes the interoperability problems with Epic or Cerner or any of the other EMRs. And you can build on that. So the key is to create, we'll get it this way. What if you had an Accenture for digital transformation in healthcare, where any health system or any company could go and say, boy, what I really need is this, this, and this. And we could create the digital things, or we already had those digital apps to be able to do that.
Do you
Our biggest success this year was actually creating a wearable, carbonized temp wearable, which became an IPO, a company called EcoFiber, which you'll go to sleep at night, it'll measure your respiratory rate, it'll measure your heart rate, etc. That's the beginning of that revolution.
Can it call, if you're sleeping and you're dying, it can call the ambulance to come bang down your door?
Yeah, the key will be that, and again, we've got some work to get to that point, but what we're working with, and we have some contracts with some of the voice recognition pieces. The key would be that when you wake, if you're asthmatic, Chris, and you wake up in the morning and you're wearing the EcoFiber wearable, that you wake up in the morning and you say, hey Siri, play the daily podcast.
Yeah.
And Siri will say, well, not so fast, Chris. Before I do that, your breathing was really labored. The AQI is X.
Right.
Take an extra inhaler. Actually, I just started at my HomePod now is having Siri talk to me.
I heard it.
Yeah, so.
Oh, he fell off the pier. It looked like you fell off the pier.
Yeah. So, no, but I think that's the future that exists in every other part of your consumer life. Why shouldn't it exist in healthcare?
And so in the COVID world that we're in now, what are you guys doing right now? I heard you tell me about a month ago, you guys were doing 3,000 patient visits at home with real physicians to keep them from having to go in the hospital. Where's that gone since?
Yeah, so we're now doing 4,000 telehealth visits a day.
Okay.
Now put that in perspective. We had started one of the largest telehealth entities back in 2013, where people thought I was on drugs. Like why the hell are you investing $50 million in telehealth? And we had unlimited supply with almost no demand, right? We're doing 50 a day.
Wow.
Well, the cool thing is that now we have, unlimited demand, and we're doing it for even other folks. But I think the key, Chris, is getting it away from just telehealth. It sort of amazes me when I hear some other hospital CEOs say, I discovered, telehealth. Isn't it cool? It's not the telehealth thing. It's like getting back to the banking thing. I don't think if you made a mobile deposit today, you went, oh, this is really cool. I'm going to tell a bank this morning.
Right.
No, it's just that you've got.
I'm depositing my check, and I don't have to go down and touch the ATM screen that maybe somebody with COVID touched.
Well, yeah, but you don't think about it. It's just that, God
natural.
forbid if from, when I get mad on those Sundays from 2 a.m. to 6 a.m. where they're doing the if it's Schwab or Wells Fargo, they're doing the maintenance on the website.
Right.
What do you mean I can't do a mobile deposit till 6 a.m.?
Right.
But imagine, that's what healthcare should be. It should be if at 3 a.m. on Sunday, something shows up in my AI that there's somebody for me to talk to. I mean, imagine if you had that same kind of thing of, gosh, what do you mean it's 3 a.m. and I have to wait till 6 a.m. to do my mobile deposit, as opposed to healthcare. Well, I can't even call anybody till 9 a.m. And then maybe they'll give me an appointment 2 weeks from now.
Yeah.
When some human decides they'll do it.
So you have real physicians, sorry to interrupt, but you have real physicians who are doing these phone calls, and are they actually able to not only diagnose what the person's describing or showing them on video or just describing on the phone, but also prescribe prescriptions so that they can just have them delivered to the house?
Yeah. 24/7. emergency medicine physicians, literally all with your chart. You know,
Right.
Chris, if you were one of our patients, you would get on Jeff Connect, and we'd, hi, Chris, how you doing? We know you have this, this, and this.
Right.
Oh, by the way, Chris, let's say it's 2 o'clock in the morning.
Right.
You know, I really think you should be on this medication. Oh, the closest 24-hour
Wow.
CVS to your house is wherever it's on, you know, Sepulveda Boulevard. I've just done the prescription. They'll have it together. They'll have it ready for you in 20 minutes.
Wow.
That exists today. If we think you need to come in, we could say, well, the closest Jeff urgent care to you is, you know,
Right.
don't come into the emergency room. The closest Jeff urgent care to you is, or we take care of it. We've even done things where we're now starting to send some people home with some things like Livongo if they have hypertension, where we send them home with blood pressure cuffs. Think about congestive heart failure and readmissions. Believe it or not, in 2020 in the United States, the determinant for congestive heart failure patients maybe need to readmitted is they've gained a lot of weight, because without going through all the physiology, if your heart's not working very well, you third space, what we call third spacing liquid. So all of a sudden you're gaining a lot of weight and get what's called edema. We still have literally places where people have to come into their doctor's office 3 times a week to get weighed.
Wow.
So what we did was we gave all our congestive heart failure patients, you know, withing scales. And we just said, look, you got one job.
Yeah.
Beyond not eating like salty stuff and pizzas and that stuff,
Right.
but get on the scale once a day. And we have AI that determines if their body weight is increased by more than 7%. And if it has, somebody will call them and say, you know, we'd really like you to come in.
Toilets. Are toilets going to tell us we're eating the wrong food, or we have too much sugar in our diet?
That's an interesting one. A great philanthropist, a guy named Bernie Marcus, who was one of the founders of Home Depot, has given Jefferson almost $50 million to create the first academic department of integrative health, global health, and nutritional sciences. And I think the whole issue of what we like to call the neutral biome is really, really the next big thing. And it's much more than eat the right stuff. It's literally taking your genome and literally looking at what through, you know, if you're 46 years of what you've eaten have done to your bowel flora and fauna, and guiding you as to the best things. It's not the classic eat less, you know, don't eat, you know, it might be different for you. You might need more carbs, or you might need, so the key of really turning integrative health, nutritional sciences, even things like yoga and mindfulness into a real academic pursuit. One of the clinical trials we now have approved by the FDA is very, 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 very high doses of IV vitamin C for COVID. And it's actually been, to this point, pretty successful in certain folks. So I think we have to recognize that there are things beyond medicine and surgery that really work, and we have to look at how other countries and other places in the world actually take care of people.
Right. So you guys are working on a vaccine, is that right?
Yeah, it's really exciting. We have a mad scientist that runs our vaccine center named Matthias Schnell. It sounds like almost like one of those typecast guys. So Dr. Matthias Schnell, he had been one of the leaders in creating the Ebola vaccine. And what he decided to do, so if you think about the COVID vaccine, it really gets down to speed and safety, right? It's not a science fair experiment. It's not a creativity thing. We need to get something that's safe and speedy.
But it's also a competition, it seems like, between countries and between different people who want to be the first one in. And that seems concerning as well. But I know you were headed in another direction. But
No, but that's true. But so we took a different approach, because like a lot of people are saying, we're going to do the first DNA vaccine. We're going to do the first this vaccine. Problem with that is that's not going to happen. It's a neat idea, but it takes years and years to be the first. Is that going to be safe? So what we did was, or what Dr. Schnell did is, there's 100 million rabies vaccines that are manufactured a year. again, especially in African countries. So we took the rabies vaccine as the carrier because we know it's safe, and then added the COVID protein on it.
Mm-hmm.
So the beautiful thing about that is we don't have to worry it's safe. We know it's safe, and if it's effective, we have literally 100 million that we could make tomorrow. So
Wow.
we're starting human trials. We have 3 drug companies that have invested in it already, and we're pretty excited about it.
But if you guys come up with the vaccine that works, first of all, what's the soonest that I read Pfizer said that this fall we could potentially have an emergency vaccine available?
Yeah, I think that's about right. I think, our human trials, because ours is based on the rabies vaccine, if it's effective, it could be a little earlier than that.
Wow.
It could be, in the September, October range where we would basically get what's called compassionate use.
Right.
From the FDA, where we could,
Right.
try. We're doing human trials now on some clinical trial volunteers, so that's already starting in May. So assuming we could get enough people, and the beautiful thing is our initial partners in India, and they have a lot of people,
Yeah.
and they have sort of less restrictive clinical trial laws than we do. So, it's a beautiful thing because
Yeah.
there's a company in Philadelphia, to get 50 people in Philadelphia with all the regulations and stuff. In India, you can get, 5,000 in one province.
Wow. Yeah.
Pretty easily. So we're pretty excited. I mean, look, there's not going to be one, but we think we have a shot at being, one of the 6 or 7. And, obviously, if that's the case, that's a big deal for us, for our vaccine center, big deal for Matthias.
Right.
No, but I mean, I think that's one of the cool things about.
Do we want to have 6 or 7 though in this world that work, or don't we want to know which one's the best one and have everybody then use it and make it all over the world and nobody make a profit on it? Or how's that going to work?
Yeah. Well, that's good. I mean, there's a bit. You want to have whatever. There might be multiple ones that work because we're all coming out from a different thing, and then you want to get into whatever can be made the most. The chances that one is going to be able to make 2 billion doses.
Right.
So if there's 6 or 7, and they've all got partners, like if somebody's partner is J&J and our partner is Merck, and then that's all good. Again, there's.
But you guys are going to share information with each other, right? I mean.
Oh yeah. That's not an issue.
They're all going to be pretty similar, or they're going to be.
No, they're really not. They're all attacking different parts of. The way that vaccines work is you either go after the DNA of the virus, or you trick the protein that the virus is on. But I think getting back to what makes us special is, we're one of the things I always wanted to create is sort of this best of both worlds, where we could be a top 25 academic medical center by traditional senses, doing the kind of things that Dr. Schnell is doing, but then be the place to work with Silicon Valley. So like I always kid around because there's a couple groups. We're in the group of the top 25 traditional academic medical centers. I get invited out every January.
Right.
It's the Hopkins, it's all the ones that about, Mass General. And then we're in the group of the top 25 cool, out there, like health systems and universities.
Design center and.
Yeah, exactly. With all the different things. And that's out in San Francisco and in Napa. And we're on that one. And I always kid around. Of the top 25, like traditional ones, we might be toward that bottom tier. And of the top coolest ones, we might be toward that bottom tier. But here's what's cool. There's nobody even in the same stratosphere that goes to this meeting in January and that meeting in July. So the fact that we can be, top 25 in both is really exciting.
Well, you've always been an innovator, and you took, what was it? Fast Company called you one of the most creative people in business.
Yeah, that was the coolest award I've ever gotten.
Right.
Fast Company does the 100 most creative people in business.
Right.
I was number 21.
Okay.
The only healthcare executive in the 100. Actually, right ahead of me was Reese Witherspoon, which was
pretty
cool
creative.
in a way.
Yeah.
And I mean, we've all seen Big Little Lies and Little Fires Everywhere, so that's pretty cool.
There you go.
So and the great thing about that is because it was Fast Company, and is that my kids, who are all in their 20s and 30s, and I've gotten lots of different academic awards. I've been dean of 3 different medical schools. But when that came out, because they all get fast come and said,
Ah.
"Oh my God, Dad, you actually are sort of important." So
But what was that based on? So why did they call you a creative innovator? What have you, what was it that you did? You took it from 3 to 14 hospitals.
well, I
What were
think it
some
was a
of the
combination.
criteria?
Yeah, it was that in 1 year we did 6 mergers of bringing those together. We did that. We started the largest telehealth piece, and we merged with the #3 fashion design university and created the wearable. So the concept of, like, who the hell would have thought that you would take this conservative health science university and merge with one of the top fashion design universities, and then we did an MD Masters in Design with Princeton University. So the whole concept of creative partnerships. My role in the World Economic Forum is looking at what kind of creative partnerships will the fourth industrial revolution sort of engender. The fourth industrial revolution is everything from robotics to AI to
Right.
5G to some of the things we just talked about. And I think that's what's exciting to me, bringing together entities for if there's a health system out there and say, oh my God, we just got killed by the pandemics, the insurance companies are killing me. At Jefferson, we said, yeah, all those things are true. That's the traditional healthcare ecosystem. But there's going to be $1 trillion spent on transforming healthcare.
Right.
So if you're running a hospital or health system out there, why aren't you sharing in that? Why are you going to HIMSS or going to these different things and buying something from somebody? They need you. So we've created this sort of, almost every deal we make, we are a co-developer or we get equity in it, et cetera. So while it might be tough on this end around revenue or insurers, it's really good on this end. It's a little bit like diversifying your portfolio, right?
Right.
$6 billion company. And if all we're doing is getting heads in beds and, and doing hip replacements, and something like the pandemic hits and you're really hurting. If you're also there and have 10, 20 companies like we have that are transforming healthcare
Right.
and the pandemic hits, well, you're going to do really well in that post-COVID world. So this part of my world is doing really lousy. This part of my world is getting ready to do really well.
So when's the lousy part of the world going to start seeing the light at the end of the tunnel, the end of this thing? I just heard today that we're hoping for, phase 3 in Los Angeles to be implemented soon. And now we're hearing it might be another 2 or 3 months.
Yeah,
Did you hear
I
about
think
that?
it's a great question. I think the problem is there's a few problems. One is I think people haven't come to terms that nothing dramatic is going to happen between now and the vaccine. So if you're a conservative person that doesn't want to get COVID, you should not go out of your house till probably next January. That's just a fact. So now the risk benefit starts to change.
Right.
So once the surges go down, the chances that if I'm with 10 people, maybe 4 weeks ago, 6 of them were carrying COVID,
Wow.
and now maybe only 2 of them are.
Right.
That's where the risk benefit gets together. And I think that's what we're starting to see of people saying, all right, especially if you're younger and you're not high risk. Look, I don't want to get COVID, but the difference between saying I'm not going to start the economy at all, or I'm not going to go to work, or I'm not going to do anything, I'm not going to see my grandkids for a year, versus that, I clearly got it when we were in the height of it.
Right.
And unless somebody tells me that there's something different between June 20th and May 20th, we're doing that with my family right now. I have 2 grandkids. They're coming down from Rhode Island to our shore house.
Right.
And they said, Dad, why don't you come up and, come back to the house on Sunday? And, my guess is my wife won't do it because she's more conservative than I am.
Right.
My guess is I will. They're more worried about me than I am about them because they're
Right.
obviously young. But it's a risk-benefit ratio. I'm looking and saying the chances that that one family doesn't have it, they don't have any symptoms, I'm willing to take that chance. If I'm not willing to take that chance, then I'm not going to do it on Labor Day either, and I'm not going to do it in Christmas probably.
Right.
So that's to me that's where I think people are going to start making the things. I think Gavin Newsom and Trump and everybody else are trying to. I know everybody criticizes everybody, but it's a tough decision of
Yeah.
the economy it shouldn't be economy versus health. It's
No.
where does the risk benefit? Now, here's the other piece though, Chris. And the thing that everybody listening to this, if they're a patient or health system, should really be concentrating on. We have to, every one of us has to start calling patients and say, go to your doctor, go to your hospital, call your doctor, and start to get care again. There was just an article today that beyond the fact that hospitals are losing $60 billion a month, that's the financial side, 57% less heart disease related visits. 38% less neurologic disease related visits, 62% less mammograms and breast screening.
Nobody wants to go to the hospital.
Well, but here's the problem. You either have to decide that all those things weren't necessary. I don't think that's the case.
Right.
Or that we're going to have a lot of heart attacks, a lot of diabetes, a lot of strokes, and a lot of breast cancers. And so then what you have to say is, so if you take Jefferson, we have enough PPE. We feel 100% safe. There's not one patient, not one. We have 14 hospitals that came in for a non-COVID thing that has gotten COVID.
Great.
So then you start to say, in that risk-benefit thing, I'm at much greater risk
of staying
not getting my mammogram. Yeah. We can't do them at home. I'm at much greater risk if I have high blood pressure, not getting a stress echo or whatever it is. So we're literally having our doctors call every patient and say, look, Chris Lee, you've got hypertension. Let me explain to you why it's safe to come in, but let me explain to you what, more importantly, why it's not safe for you to not come in.
The other thing that we haven't talked about is the immunity. What's up with the immunity test? If I got an immunity test and I knew I carried the antibodies and I was immune, I might feel pretty comfortable with doing that, with going places.
Yeah. So that's a cluster mess.
Is it?
Yeah. There are 28 different immunity tests, antibody tests. There are people that test positive in some and negative in others. We also don't know for sure that if you have antibodies, you're really immune. We don't know enough about.
When are we going to know that? When are we going to know that?
Well, you've got
to be immune for like a few days at least, right?
Oh yeah. Look. Get back to what I said, Chris. It's risk benefit. So where I think the antibody test makes sense, I have 35,000 employees. If I'm thinking about who I want to bring back to work,
right,
I should antibody test all my employees. And if I'm going to bring back half my employees, I'd rather bring back the ones with positive antibodies. Point is it perfect? No.
What about going to conferences? Are you going to speak at a conference with 1,000 people in September?
July, yeah. Well, not 1,000, but I'll be at the Forbes Napa conference.
But I'm saying, okay, so in July you're willing to do that?
Yeah, I'll be at Meadowood in July. Yep.
You're going to wear a mask on stage when you're speaking, but you'll be far enough away you won't need a mask on stage.
Yeah. I'm gonna, yes. I think that I think the key will be, they'll probably put it in a bigger room so people can be a little farther apart. We'll do masks. We'll do whatever necessary. But I think at some point we have to get back to human contact. I mean, I don't think everything has to be that way, but some things do. I'm going to go out.
Do most of the people in healthcare share that opinion with you? Is this all political that we have to get back to work, or does the healthcare community also totally believe in that because the beds are empty? There's not as many people coming in with COVID. Is this really the peak is behind us?
Well, when you say healthcare people, it's like saying, do all white people think this or whatever? I think we at Jefferson feel very comfortable that we can take care of patients for other things other than COVID. Our numbers are down. We have an incredible amount of PPE, and we have an amazing safety team. In fact, tomorrow there will be a press release that Aramark, the big food company, global company, has chosen us as their safety partner to create something called EverSafe. So we feel very good about it. The issue about, what do health professionals think about going to conferences? Honestly, Chris, again, it's not healthcare professionals, it's individuals. Everybody has, look, we just talked about the fact that I've done 6 mergers in 5 years. If you went to a lot of healthcare professionals, they'd say that's suicide. That's not going to work. Well, it's worked incredibly well. So I'm sure there's some people that are in my position that are saying, I'm not going to leave the house because I don't think it's safe. I think the problem we have to understand when you start to deal with the Dr. Fauci's, and my daughter is a PhD in public health. Um, Public health, basically, the view is, when is it safe where nobody has a chance of being harmed? And so the answer is, Steve, you're 66 and you're somewhat high risk. What would be the safest thing for you to do of having no chance of getting COVID? Safest thing for me to do would be to never leave my house. I mean, it just would. I'm not doing stupid stuff, but I'm going to the office every day. I'm not going to the hospital, but I'm going to the office.
Right.
I'm not, most of the conferences have either been canceled or I've canceled. Right. The first one that I've agreed to do is in July because it's an invitation only smaller conference.
Okay. And everybody's going to get the immunity
Tampa.
test, right?
Yeah. And my guess is we all will do an antibody test at that point. I have another thing, I have a couple of things in September. So yeah, I'm going to be willing to do that.
Got it. So some people are going to be willing to do it. Some people, it's your decision. Yeah. But what about cutting hair and what about racquetball? I play racquetball. My wife cuts hair.
I've had my Italian barber come in my concession was I went from every 1 week to every 2 weeks.
What's that? To get your hair
getting my hair cut.
All you need to use is a clipper, like me. You don't need you have a guy who does that for you?
I do. I have this Italian guy.
Look, you could look like me and just do it yourself.
I have Italian guy John Romano who comes in every 2 weeks.
John Romano came in and did my hair.
John Romano. He's been doing it since he's been 12 in Sicily. And I'm afraid, it comes from Sicily. I'm afraid to tell him not to come. So,
right. He'll get angry.
Yeah. So look, I think, look, this is what I think isn't going to happen. I think all this obsession with when's Yankee Stadium going to open, that's not going to happen for a long time.
Okay.
Because you got,
too many 20,000, yeah,
20,000 random people.
What about planes? What about racquetball? What about going to the barber and sitting in a chair with all the other people in the salon? Or
so I wouldn't do it with all the people in the salon, but I would go to a barber that I know is disinfecting stuff with the right stuff and take that chance.
Plane? You're gonna fly in July?
I'll fly. Yeah, I'll fly. I think most of the planes have done the kind of thing of getting rid of middle seats, or just having one person in first class and everybody wearing masks, including the stewardess. So I think that's okay. I've talked to the American Airlines folks about what they're doing and disinfectants, and they're using pretty much what we use in the hospitals.
Got it.
So I think that's okay.
Last question about COVID, because we went on a COVID tangent, but it was obvious we had to, knowing what you do. But what percentage of the population do you think yourself, or have you heard, has gotten it at some point? Because most people, more than half, don't even know they got it, right? So how many people, what's the percentage that really you think it is that got it in this country?
I think when we're done, I think by the time we have a vaccine, we'll have somewhere around 35 or 40% of the population having got it.
And those were people who were really out there kind of more in general than people who kind of stayed at home. The stay-at-home.
In your state, they published some results, and it was somewhere between 10 to 15 times as many people had positive antibodies as thought they had COVID.
Right.
I have a nephew in LA, called me up with some symptoms. He's a big, strong 20-some-year-old, plays baseball, the whole bit. Said could be, could not be. We worked out a telehealth visit. We got him tested, had COVID. He felt shitty for 5 or 6 days, stayed at home for 2 weeks, got the antibody test, his sister just had a baby, so we said, all right, even though you have positive antibodies, I'd probably stay away from the baby because she definitely had COVID. But, he's now out doing stuff. Yeah. So, there's probably a whole bunch of people that, that have gotten it with either mild symptoms or even major symptoms, and just either
it's going to be weird shifting your mind from, I don't want to get it, I can't get it, I want to get it. And then you're getting the antibody test and you're thinking, oh God, I hope I had it. I hope I may
Well,
have,
you know, look,
I hope
that's the
I'm
whole
immune.
that's the whole Sweden and Switzerland thing.
Yeah,
So Sweden and Switzerland was, we're not going to socially isolate anybody other than high-risk people.
right,
So they're basically, go out and party, kiss everybody, whatever. The public health term for that is herd immunity.
right.
Um, and, let's have as many people get it as possible that are low risk. And then, when we got Steve Klasko out, there will be so few transmitters that he's got a little chance of getting it.
Okay, so final question, final thought. COVID's behind us. There's a vaccine or a cure, one of the two, and the cure is pretty reliable at least. What is the post-COVID world? I know you've written about this, you've talked about it.
Yeah.
You think it's a pretty positive place, and you think we're going to have a lot of new things in that world that we don't now that we need it, right?
I'll say two things. I think it's a positive place for places that are willing to think literally what's going to be obvious 10 years from now and do it today. I think it's a really negative place that people think that they can live on their existing business structure. If you're a hospital and you're thinking you're a hospital, you're dead. Because I think that literally you're going to have to think of yourself as healthcare with no address. How can you want everybody that is healthy to say, I need the Jefferson app, or I need the Cedars-Sinai app while I'm healthy, as opposed to only thinking about you when you're sick. So, my aha moment, Chris, was I worked at Apple pre-iPhone. Now, again, if you think about that world, it was Gateway, it was Dell, it was Windows, it was HP, and Apple had 3% of the computer market. And if you ask people back in the early 2000s, what do you think is going to happen, let's say 10 or 15 years from now? They'd say, oh, Dell's going to have even cooler laptops.
Right.
And Gateway will deliver them to your door because they were the customized ones. Oh, and it'll be Windows 2020, and it'll be really, really great.
Right.
And Steve Jobs basically took money from the old math of creating operating system and computers, which was the only thing the company did, to this crazy new math of a digital lifestyle.
Right.
And if you remember, the first thing he put out was the 200 MP3 iPod.
Amazing.
The Wall Street Journal thing was Steve's on crack or on drugs. I mean, he was on drugs, but he wasn't on crack. So I think that he was able to uniquely see what was happening. And when I give my talks, I talk about one of my mentors has been John Scully, and John was the guy that came from Pepsi because the board wanted Steve to act like a CEO. So imagine this. He's coming from Pepsi. So he goes to Steve and he says, look, Steve, you're Steve Jobs, it's fine, but we're a NASDAQ company. You got to come up with a 3-year strategic and business plan. And he showed him Pepsi's. It was a glossy thing with spreadsheets and whatever. Look, I'll give you 3 months. I'll bring in McKinsey. I'll bring in Accenture, whoever you need, but it's got to look like this. So Steve calls him up about 12 hours later and says, John, I have your 3-year business and strategic plan. He goes, I can do it. Well, come to my office. So it was on a blackboard. And in my talks, I show this. It was on a whiteboard. Year 1, we change. Year 2, we change the industry. Year 3, we change the world. And if you think about it, that's what he did.
Yeah.
Year 1, they changed from the old math of investing in just computers and operating systems to new math of digital lifestyles.
Yeah.
Changing the industry was things like the iPods and the iPads.
iTunes.
One could argue, and iTunes and the digital store. And then changing the world, one could argue, was iPhone. It democratized so many things.
Absolutely.
So that's how I've stolen that. We talk at Jefferson about the old math and the new math. The old math is academic and clinical. The new math is innovation and strategic ventures.
Yeah.
And so we've gone through the we change. Changing the industry is what we started to do with healthcare with no address and telehealth and the wearables. And I think the changing the world will be some of the things we're now looking at with General Catalyst and others around really going after the social determinants of health.
Mhm.
of the fact that, the fact that underserved folks and minority communities had COVID at a 10-to-1 ratio as Caucasians in better communities. And it's not because they had genetic predisposition, because they have higher rates of obesity, diabetes, hypertension. So that gets into the disrupting food deserts through drone delivery. That gets into some of the stuff around education and housing that, even though we're a hospital system, we're tackling head on with digital transformation. So to me, that worked for Apple, and
Right.
I think it's exactly how any healthcare CEO or insurance CEO should be thinking post-COVID.
Awesome. Well, it'll be interesting to see what you guys do. You're a leader and you're amazing. And I like the idea that you guys have the design school, because you guys are going to be a leader in wearables, I imagine, because of that. So that's going to be exciting as well. So amazing.
Yeah, it's been a really interesting culture thing to take all these fashion design people. Like
Yeah.
our keynote speaker was the guy that started Queer Eye for the Straight Guy, Colin. So
Yeah.
it's just been great because, having that kind of creativity embedded, he's on our advisory board, embedded into a health science university,
Great.
it creates some very interesting synergies.
That's great. Well, thank you very much, Stephen. This has been amazing. I really appreciate your time. I hope everybody else did as well. And I will look forward to talking to you again soon, and have yourself a safe and well rest of the month. And hopefully we'll be able to look back at this thing as a memory soon.
And thanks, Chris. And I'll send you, I started my career as a DJ. So I now have one of the more popular Spotify COVID things everywhere from,
You had the big hair, right?
yeah, I did have the big hair, but like don't stand so close to me. I can't get next to you by the Temptations.
Perfect.
Dancing with myself is a good one, or Radar Love. So and the best one I think is Roberta Flack. The first time ever I saw your face, for people who fall in love when they're with somebody with a mask. So
Online.
there's all sorts of stuff on. It's called Corona On by Stevie K the DJ. So you can
Stephen
check that
K
out.
the DJ with a PH.
Yeah, with a PH, exactly.
Nice. Awesome. All right. Well, we'll look
All right,
for it.
Chris.
Thank you, Stephen. Have a good one,
Thank
sir.
you.
Great
All
to see
right,
you.
take care. All right, bye-bye.
Bye-bye.